All right, Dr. Donat here. We're just here with Mitzi, who's been nice enough to share her thoughts about her experience. We were just going to look at her picture. She's about 2 months out from a lift, a LuxeLift, so lower face, neck, volume restoration, under eye blepharoplasty to reduce the volume excess there. So I think she's very pleased. So we'll just take a look at the pictures.
Oh my gosh.
Isn't that cool?
Wow.
So so we see the improvement along her neck here. Maybe we'll zoom in just a little bit.
That was
more.
the first thing my husband said after the procedure was, oh my gosh, you have your neck back.
Isn't that cool?
Yeah, that's cool. Look at that.
So.
That is crazy. Look.
So.
Wonderful, wonderful, wonderful.
And we can hold it up, hold up the picture so people can see side by side. You kind of forget.
Shows, yeah.
You kind of forget what the neck was like.
I know. That's what I was. That's yeah, exactly.
And then we can hold this up. You mind if I hold this one up?
No, you're fine.
Yeah.
This is just
so pretty significant difference, I think, in the amount of neck show and the jawline.
Definitely, definitely.
And then also the under eye area.
Wow. I didn't know I looked so rough until it fixed me up better. Yeah, for sure.
So.
That is amazing.
Cool.
Amazing.
Hold up this
I
one too,
thank
if I
you
could.
very much.
Thank you. That's so
If I
nice.
had to do it over again, I'd do it 100 times
All right,
because
thanks.
it's well worth it.
It's
And it
fun.
wasn't even like painful.
Good.
Because
good.
after I explained to people, you know, the procedure and all that, they're like, "Oh," but it wasn't. It was not even the recovery and all that. It wasn't at all painful.
So much that you're thinking about doing the upper lids now. Right?
Yes, I am. Yes, I am. That's next on my list.
Yeah.
Yes, but
So
only
here's
by
the-
you.
Oh, thanks. So here's the difference in the lower lids, just so other people can see it as well. So she had a little bit of fullness in the lower lid area, and that just makes her look more rested. A little more volume in the cheeks as well.
Yeah, I see that in this picture especially. That's great. Complete difference.
Yeah. So, but it still looks like you, right?
It does, yeah. Oh, yeah, because the night before my procedure, I was at a restaurant, and there was a lady there, and it was obvious that you didn't do her work.
Oh, thanks.
And I was sitting there, and I looked over, and I told my husband, oh my gosh, this is an omen, because I don't want to look like that. He said, no, but that's the look I was afraid to have.
You didn't want to look done.
No,
Right.
I didn't know. And I don't. I look like I did 15, 20 years ago.
Awesome.
I work in a school, and comparing this picture to 20 years ago, I'm 20 years younger.
Isn't that cool?
Yeah. It's amazing.
What, didn't your grandson say something?
Oh, I had my grandson out to dinner. They hadn't seen me since the procedure, and he was sitting across the table from me. He's 8, and he was sitting across the table from me, and he says, Gimme, you look different. I said, yeah, well, is that a good thing or a bad thing? He said, oh no, you look like you're a teenager.
That's
Hey, 8 years old. Can you
Victory.
beat? You can't beat
That's awesome.
that. That's the truth.
They're brutally honest, right?
They speak the truth. Yes.
Awesome.
I am totally happy, totally pleased. It's just
Nice.
amazing to look at them.
Good. Well, you keep these.
Okay.
So, and if you can tell us, what made you decide for yourself that you wanted to do something like this? Just out of curiosity.
Just like you can kind of look at the before and after that. I was just feeling old and haggard, and this is just like lifted my whole attitude on
Good.
life.
Awesome.
You
Awesome.
have done that for me.
Thank you.
And
I really appreciate that.
really appreciate
Thank you. You're so nice.
Thank you.
It's our pleasure. The whole staff enjoys doing it. So.
Your staff is wonderful.
Thanks.
Yeah,
Thanks.
I think
We really
they pretty much keep
take
you in
pride.
line and keep things going. Truly, but you get the whole thing,
I
the
need
whole
that. I need
deal
that,
was
yeah.
a great
Good.
experience.
Thank you so much.
Thank you.
Well, fantastic. Well, thanks again, and we'll see you again soon.
I'll be
All
back.
right,
I'll
thank
get
you.
those eyelids done.
Okay,
That's
all right,
next.
sounds good. Thanks,
Thank
Betsy.
you.
All right, we'll see you next time. Thanks.
Uh-huh.